Society of India, whose steadfast leadership has been an inspiration. It gives us great pleasure to receive our distinguished visitors and resource people. I want to use this opportunity to thank everyone who came to participate in this important discussion. Thank you and have a productive and educational webinar, everyone.
To begin any event, we need the Almighty's blessing. What in the Holy Spirit. Dear Almighty and ever loving God, we glorify and thank your name. You have showered us with so much blessings, and your presence continuously reminds us of your faithfulness and guidance. May we humbly ask you to shower our speaker today of your greatest inspiration so that he may share the most of his knowledge, his field of expertise, and his respective topics. May we also absorb the invaluable knowledge experiences and put it into practice what we may learn today. Your infinite blessing would mean the success of the seminar. May we be a living witnesses of your genuine love through the enactment of the knowledge acquired through this activity. We ask this in the name of Jesus Christ, our Lord and Savior.
Ruchika, Janta sir is not there in the meeting. You can proceed for Ajay sir.
Okay, Kanvi. Good evening, everyone. This is Ruchika Gupta, the Assistant Director of Global Forum for Youth Development, Global Forum for Sustainable Rural Development. It is my absolute honor to introduce Professor Dr. Arvindam Deshmukh Sir, the esteemed President of the Microbiology Society, India. Dr. Deshmukh Sir, the founder and All India President of the Microbiology Society, India, has been instrumental in building this pioneering organization that fosters collaboration and innovation in microbiology nationwide. Under his leadership, the Society has become a dynamic platform uniting professionals and students across India to exchange knowledge and drive forward thinking research in microbiology. Throughout this remarkable career, Sir has made invaluable contributions to microbial research, especially in microbial biodiversity, ecology, and biotechnology. As professor and head of the Department of Microbiology at Sahib Ambedkar Marathwada University in Maharashtra, he influenced generation of students and researchers, setting high standards in both teaching and scientific inquiry. Sir has authored numerous influential papers that have significantly expanded our understanding of microbial systems. His dedication has not only advanced scientific knowledge but has also inspired countless microbiologists across the country. We are deeply honored to have him with us today. Please join me in welcoming Professor Dr. Arvindam Deshmukh Sir to our podcast session. Over to you, sir.
I would like to inform sir is in a meeting somewhere in the conference in Nepal, so he will not be joining. So now I would like to welcome everybody. Myself Kanvi, a postgraduate in microbiology from Punjab Agriculture University, and I'm also an assistant director for the Center of Global Center for Sustainable Agriculture and Food Security under the same forum, Global Forum for Sustainable Rural Development. Now, I would like to take the honor to introduce the chief guest of the event, Dr. Avik Acharya Chaudhary sir. Dr. Acharya sir is the assistant professor and head in the Department of Biosciences, JIS University, Kolkata. His research areas comprises of cancer, cell biology and molecular biology. He worked on cancer cell signaling during his doctorate studies and in Indian Institute of Chemical Biology, and he has got his doctorate degree from the University of Calcutta. His work spans includes multiple domains, including cell biology, molecular biology, signaling pathway, and his major area of interest are breast cancer, chronic diseases, and cancer. His investigations delves into the complex molecular mechanism underpinning and elucidating the novel therapeutic targets and strategies. Beyond oncology, his scientific curiosity extends to investigating the antibacterial properties of novel inorganic molecules. The broader scope underscores the interconnectedness of biological systems and the potential for cross-disciplinary discoveries to inform advancement in multiple fields. Dr. Chaudhary is also heading a project which is funded by ICMR, and it's dealing with the drug resistance cancer. Avik sir, I welcome you to the stage to kindly enlighten all of us with your knowledge. Over to you, sir.
Thank you, Kanvi. Good evening. I'm Dr. Rubhika Charia Chaudhary. I'm the Associate Professor and Head in the Department of Biosciences in JS University, Kolkata. And thank you for inviting me. I'm delighted to be here. And as I have, thank you. So as I have only 10 minutes to share my knowledge, I'm not a person that who work with diabetes. I am actually a cellular signaling, work with cellular signaling and signal transduction, that genesis and cancer development and progression. So I have prepared a small presentation. Can I share my slide?
Yes, sir,
Yes,
please.
sir, you can.
Okay, thank you.
Yes, sir, it is visible. Can you please check the slides are moving or not?
Let me share my whole
Sure, sir.
screen.
Sure, sir.
Is it visible now?
Yes, sir.
And
Yes, sir.
let me
Yes,
know
sir,
if
it
it
is
is, the
visible.
slides are moving. The
Yes, sir, it
slides are
is
moving.
moving also. Yes,
Oh,
sir. Yes,
okay,
sir.
okay.
You can proceed.
Thank you.
Thank you, sir.
So today's topic is the understanding the pathogenesis of insulin resistance. That is actually a global warning threat right now. So what are the scientific advances and strategic intervention? So my aim is to provide you with a comprehensive understanding of this complex condition and its role in diabetes and the challenges and the opportunities ahead. So diabetes, which you already aware, it is a chronic metabolic disorder, and it is affecting almost over 450, approx 450 million individuals globally. And it is defined as the disorder that is with high glucose level, and that can cause significant damage to various organs like heart, blood vessel, eyes, kidneys. Even my father had diabetes type 2 for say 30 years, and he is no more right now, but he actually died suddenly, and that actually due to high diabetes surge or something like that. Even doctors couldn't say what actually caused the death. So to begin with, the insulin resistance in healthy cells, the insulin allows glucose to enter and be used for energy. This is the very simplest role of insulin. But insulin resistant cells, often in muscle, fat, or liver tissue, this process is disrupted. Okay, that it is intake by the cell, this process has been disrupted. So even though insulin is present, the cells do not respond effectively. And as a result, the glucose remains in the bloodstream and leading the body to produce insulin to manage the blood sugar levels. Now, some major impacts of insulin resistance are, that is, impact on blood glucose level. That is, it remains in the bloodstream instead of entering the cell. Now, it increased the risk of type 2 diabetes. That insulin resistance is a major precursor to type 2 diabetes. And when cells do not respond effectively to insulin, the pancreas compensates by producing more insulin. So over time, this constant demand can exhaust the pancreatic beta cells. And that leads to the decreased insulin production and onset of type 2 diabetes. And the third is the development of metabolic syndrome, like high blood pressure, elevated blood sugar, excess abdominal fat, and level of abnormalities in the level of cholesterol and triglycerides. Now, next is the increased cardiovascular risk, non-alcoholic fatty liver disease, chronic inflammation, so you name it. So there are several chronic diseases to some basic level diseases that can be caused by the diabetes and by the insulin resistance. Now, this is actually a very simplified thing. This is actually signaling by which the insulin metabolism takes place. So insulin, we all know that it works through RTK, that is receptor tyrosine kinase. And this has the insulin receptor specific protein, and they are PI3K. And PI3K, you can see this PI3K is activating the second messenger, and then it is activating the AKT. So in this pathway, the AKT is the main player. The conversion of this PIP to the PIP3 is the main player, and PI3K activation is the main player. So if you see, this AKT is responsible to import that GLUT4 receptor, which is responsible the entry of glucose inside the cell, that goes to the plasma membrane. It actually imports that GLUT4 in the plasma membrane so that glucose can enter cell. Now, in insulin resistance, it is actually the PI3K AKT level is diminished. Okay, and that impaired the insulin signal. Also, the IRS phosphorylation, that is not done. That's why the signaling has been decreased, or the signaling has been postponed. And the overall outcome of this process is that the GLUT4 transporter cannot be expressed on the surface of the plasma membrane, so that the glucose cannot get into the cell and they accumulated blood. So if you see here that this translocation has been inhibited as AKT and PI3K level has been diminished in case of this. So the blood glucose level accumulated in the blood itself. Now, the development of insulin resistance, that is the molecular level, what I have shown. Now, there are genetic predisposition, there are obesity and excess fat, particularly visceral fat. You know that if anyone diagnosed with blood sugar or diabetes, doctor actually suggests them to exercise or to run or to walk, okay, say for 30 minutes or 1 hour, or to reduce the belly fat or the overall body fat, so that the diabetes can be in control. So these are some pathological thing that is actually responsible for the diabetes. And there are genetic predisposition that I have already said, that the genetic factors, that is that the specific genetic mutation may be in some individual in the PI3K or the AKT level. So if any protein that is responsible for the this insulin signaling has been mutated, obviously that insulin pathway will be insulin pathway will be diminished. And also there are some epigenetic factors. Not only genetic factors are responsible for epigenetic factors like environmental factors, then diet gene interaction, longevity and nutrients, alcohol, food components, and their lifestyle. Okay, drugs, exercise, everything that can actually induce the diabetes in an individual. So moving on, this is the role of inflammation in the insulin resistance. This is a long pathway. I don't want to talk about it. You can just read it, that obesity, high-fat diet activate some of the factors. These are the molecular signaling. And this is the obesity and lipotoxicity. That is, the lipotoxicity occurs when the excess fatty acids accumulate in non-adipose tissues. So where the fats are not required, there the fats are actually accumulated, like liver, muscle, pancreas. And also activation of some stress kinases that leads to diabetes, fatty acid metabolism disruption. So everything cumulatively can cause diabetes. Now, hormonal imbalances and endocrine disorders, like in addition to this lipotoxicity and inflammation, these two are also main contributors. So hormones like cortisol, some growth hormone, thyroid hormone, that influences the insulin sensitivity and glucose metabolism. So for instance, like high cortisol levels, often due to prolonged stress or adrenal disorders, they promote the gluconeogenesis in the liver. So this raise the blood glucose level. Now, diet. We all know that exercise is king, diet is a queen. Okay, you may heard this. So a diet high in refined carbohydrates and sugars plays a significant role in the development of insulin resistance. So refined carbs, like those found in white bread and sugary snacks, that's caused the quick blood sugar spikes, leading to large amounts of insulin being released to manage the glucose levels. Even some days ago, I have seen a reel of some, maybe in Facebook, that with a live blood glucose level tracker, he is taking 1 katori of rice and 1 katori of dal. And that raises, after say 30 minutes, it raises the blood sugar level. It spiked the blood sugar level to say 240 or 250, something like that. So over time, this chronic insulin demand results in insulin resistance as cells become less responsive to insulin effects. So this is epidemiology. We all know this is the global health issue affecting millions worldwide. About 15 to 45% of the global population shows some degree of insulin resistance, with rates higher among the individuals with obesity. Clinical manifestation, if we see that insulin resistance has wide-ranging clinical implications, affecting multiple systems in the body. Its most well-known outcome is type 2 diabetes, as the body struggles to maintain normal glucose level. And insulin resistance is also at the core of metabolic syndrome and is a major risk factor for non-alcoholic fatty liver disease, and which can lead to the severe liver complication. Also, additionally, in women, if she has insulin resistance, that is close tied to polycystic ovary syndrome, PCOS. So there are some clinical manifestation that you can see So therapeutic intervention for the treatment of insulin resistance requires a multifaceted approach, like combining lifestyle changes with, in many cases, pharmacological interventions. Lifestyle modifications remain with the treatment, with diet, exercise, weight management. They actually showing the significant benefits, and they are improving the insulin sensitivity. So emerging treatments are also under investigation, like anti-inflammatory agents, then gut microbiome modulation. They represent the novel approaches that actually target the insulin resistance and its complication. Now, preventing diabetes also, obviously, this preventing insulin resistance is a critical step, and balanced diet, staying active, and maintaining a healthy weight. That's all to prevent this diabetes and also the insulin resistance. And these are some future research directions. So, exploring novel molecular targets, identifying biomarkers that lead to earlier detection, and more effective intervention like personalized medicine. They allows the tailored treatment plans and also microbiome, as I have already told you. And in the therapeutic information, new drug development, gene therapy, now digital health tools, you can monitor continuously your blood sugar level. Digital health tools can transform this treatment, this approach of treatment. So that's all. Thank you. Thank you for your patience.
Thank you so much, Avik. Thank you so much, Avik. This is Harshita Kumari. Good evening, everyone. I am Harshita, a contributor of GFSRD. I want to inform you something about diabetes, that seasonal public health professional with extensive experience in community medicine. I hold an MD in community medicine from MP Shah Government Medical College, Saurashtra University, Gujarat, and am a FAMIR Fellow 2021 to 23, serving as an associate professor in the Department of Community Medicine and a member of Medical Education Unit at TRIHIMS, TRIHMS, Arunachal Pradesh. Her career spans numerous prestigious roles, including honorary head of the Global Center for Public Health Care and Management at GFSRD, a former teaching assistant at the University of Copenhagen, Denmark, and a registrar at CMC Vellore. Additionally, she had contributed as the state maternal health consultant in Assam. Showcasing her commitment to maternal and child health, she has participated in numerous research projects funded by reputable institutes such as ICMR and UNICEF, focusing on diverse health issues ranging from hypertension and nutritional status to menstrual hygiene and the impact of motivational interventions on drug users. My scholarly contributions include around 40 peer reviewed publications in international journals where I have explored various dimensions of public health. She have also served as the editor and author of various public health books. She have also been recognized with multiple awards such as the Leadership and Excellence Award of VB Foundation and KGSS Foundation in 2021, and have received travel scholarships from esteemed institutions like the Institute Public Health Bangalore and WHO World Health Organizations. Thank you so much.
Amrita ma'am, I welcome you to please share your views on this topic. Amrita ma'am, can you proceed? The stage is all yours.
Ma'am, I guess you must be unmuting yourself, ma'am. We can't hear you.
Am I audible now?
Yes, ma'am, you're
Yes, ma'am.
audible. You can proceed, ma'am.
Yeah. So, Honorable Chief Guest, Dr. Abhik Chaudhary, Chief Patron, Dr. Jayanta Chaudhary, Joint Patron, Dr. Deshmukh, Deputy Patron, Dr. Srivastava, our keynote speaker, organizers, and my dear attendees. Ladies and gentlemen, good evening from the state of rising sun in India, Arunachal Pradesh. Today, on World Diabetes Day, we come together as a community united in a commitment to understanding and preventing and managing diabetes. This year's theme, as you all must know till now, it is breaking barriers and bridging gaps, and it resonates deeply. It reminds us that diabetes is not just a health condition, it is a social, emotional, and also economic challenge. We are here to break barriers, preventing people from accessing care, to bridge the gaps that limit awareness in diagnosis and also diagnosis and support. Support that I'm talking is from healthcare workers as well as the community, as well as the family members. So, before I start, I'd just like to give a brief history of diabetes. Diabetes is a very old disease, and it is observed on November 14. Anyone knows why it is observed in November 14? You can just unmute and answer. Because it's the birthday of Sir Frederick Banting, and Sir Frederick Banting is nothing but no one but the scientist who co-discovered the insulin. Co-discovered insulin in 1922 along with Best. So that is why it is celebrated on Children's Day. And his discovery, it transformed diabetes from a fatal disease. Earlier, people who used to have diabetes, they used to have, in later stages, they used to have complications and they used to die. But now, after this insulin was discovered by Banting and Best, this fatal disease became a manageable one. And it offered millions the chance at life. Now, people with diabetes can live longer. However, while science has made incredible progress, what is the dilemma is the societal reach of diabetes care still has barriers to overcome. And these barriers, I assure you, these are very much, we can overcome these barriers. So what are these barriers? We'll know because I'll just speak about the barriers because the previous speaker has already spoken extensively on disease process. Let me just speak on a different aspect. So, diabetes, as we know, it is a complex disease, and it has a lot of different things, interplay of awareness, affordability, and support networks. There is an interplay of all these factors. So how can we, and the problem is the barriers are also the same. The barriers are also awareness, affordability, accessibility, and support networks. So this year's theme, as I told you, is breaking barriers and bridging gaps. So the first one is awareness. So awareness is very important, and what can we do? We can give education about diabetes, and this is the first step towards prevention. So today's podcast is basically more of this awareness. So we want you to make aware about the different aspects of diabetes, and we are requesting you that whoever is present here, you go back to the community and you share this knowledge. Sometimes what happens, people Google and get a lot of wrong information, and these are the educated lot, these are the privileged lot. But there are also people who don't know how to Google even, or how to go through different books, and they don't have any knowledge at all. So little knowledge is also harmful, and no knowledge is also harmful. So we want you to take right knowledge and true knowledge from here and disseminate among the public. So this is the way we are breaking the barrier, the first barrier. Next is affordability and accessibility. Medicines like insulin and testing, because there is a very need for timely testing. Eye should be checked, blood sugar should be checked, your kidney function should be checked, liver function should be checked, and this testing becomes out of reach for many. The out-of-pocket expenditure is so high that many don't go to do it very frequently. So we have to make diabetes care affordable and accessible. Another thing is support networks. So living with diabetes, it can make someone feel very isolating. They feel that mere sathi aisa, I don't know if you understand, mere sathi aisa kya, why me? This is such a debilitating disease. I'm not able to enjoy any good food. So it might be very distinct. So what they can do, they can form peer groups. They can get community-based support groups, or digital networks is also there right now. Yeah, so these networks can provide emotional support, advice, and motivation to these people, and they can also help to maintain and manage the diabetes better. Yeah. So just I quickly review what is diabetes. Diabetes is a very complex condition, and it affects nearly 500,000 people worldwide. So you can understand the burden of diabetes. It's like great burden. Yeah, it's a great public health problem right now. And India, sadly, is the diabetic capital of the world. So there are two types of diabetes, type 1 diabetes and type 2 diabetes. And we should focus more on type 2 diabetes because type 1 is mostly autoimmune or it has other genetic causes. But type 2 diabetes, this form of diabetes is the more common form and more preventable. It is very preventable. And this is usually linked to lifestyle choices. So type 2 diabetes can be delayed through healthy eating, regular physical activity, and maintaining a normal body weight. Now, what is a normal body weight? We have a specific height, and we have to maintain our body weight according to our height. So that is the normal body weight. Now, many may wonder, how can we as individuals prevent type 2 diabetes? So let me discuss a few simple but impactful steps. So first is what you can do at home. We have to, suppose you have everyone in our family, someone or the other will have diabetes. So you already have some genetic predisposition to have diabetes. Okay, so what you have to do, you have to eat healthy food. And healthy food means you have to focus on whole food, whole grains, vegetables, fruits, lean proteins, yeah, and healthy fats like omega fatty acids that is available in walnut or almond, yeah. Control portion sizes. Sometimes happens is we eat a lot of food together. So what happens, our glycemic index, it shoots up and it is a burden on the body, yeah, in simple language if I tell. So you have to control your portion sizes. Agar bhook lagti hai, then you take small breaks and you eat frequent meals instead of gulping everything at one go. Yeah. So the food intervals between two meals should be shortened and food intake should be lesser. Okay. So that can help you. That can help you stabilize the blood sugar. The third thing that you can do is limit processed foods and sugars. So you can cut down on sugary drinks, Coca-Cola and Sprite and Mountain Dew, candies, and highly processed foods that spike the blood sugar. Yeah. And also you have to stay mindful of the carbohydrates. I'm not saying that you stop carbohydrates altogether, but then you have to you just read the labels. Kitna sugar hai? Whenever you drink something, how much sugar is there? So you'll be surprised to see how much sugar is there. Okay. So that is one of the problems. So instead of all these things, suppose instead of you are having Bournvita and everyone will advertise that Bournvita is a very good drink to have, but you check the sugar content, it is very high. It is also processed food. So instead of choosing that, you can choose complex carbs. You can mix a few almond, pista and all, and you can make a drink on your own. Yeah. So you can replace high sugary and high processed food with homemade food. Next is you can aim for a regular physical activity. Okay. If you can't go for very tough physical activity, no matter, no worries. You can aim for a 30-minute daily walking, cycling, swimming, even dancing. These are excellent ways to increase activity levels. And what happens is whatever you enjoy, it's not necessary that you have to do something that you don't enjoy at all. If you enjoy dancing, then do dance. If you enjoy walking, jogging, okay, climbing mountains, hills, some people like hiking. So you can do anything that you feel comfortable in, you like, you enjoy, so that isse kya hota hai ki you have a tendency to continue. Otherwise, what happens, I'll start today, like me also, I am not a very physical person, so I can start today vigorous activity that people, I start gymming, and tomorrow after a few days, maybe 1 week max, I'll stop. And second thing is that after doing all this, you go to a restaurant and eat all the unhealthy things, and you make jitna bhi kiya tha uska kiya kiraya pe pani, like everything you spill water on that, all your hard work. Yeah. So you should always try for things that are easier for you so that you are consistent. And yes, you have to put these are aerobic activities, yeah, whatever I told, like walking, cycling, swimming. But you can also incorporate strength training, building muscles. Building muscles has the body to use more insulin. and more effectively. So building muscles is, that's why important. Okay, people were very keen on doing aerobic. आपको gym instructor भी बोलेंगे do aerobic. No one says about muscle training, but muscle training, building muscles is very important for using up insulin. Okay, and so it helps in managing and preventing diabetes. And also, as I told you, we have to stay consistent, regular physical activity, that is 30 days daily. Okay, if you want, you can take rest one day in a week. So these are things that you can do. Also, you have to maintain a healthy weight. So healthy weight means according to your height, what should be your weight, you have to be aware of that, and you should maintain that. And you have to set realistic goals. Suppose if you have 100 kg, suppose your body weight, and you say that in 1 month I'll lose 20 kgs. So that is not a realistic goal. What you have to, even achieving a 5 to 10% reduction in body weight can improve insulin sensitivity and lower blood glucose level. Okay, so only 5 to 10% अगर आपने कम कर लिया what from your existing weight, that also is a great beneficiary thing. Also focus on gradual changes. Don't go for fad diets. These are not, you will see nowadays fad, there are many YouTube and Instagram influencers they call, and they promote fad diets, and often you will see that they drop dead. There are many instances last year also, many influencers have dropped dead because they followed a very aggressive type of food habit. So focus on gradual change. बहुत जल्दी जो चीज आप में आया नहीं है, you never gained a lot of weight in a single month. Yeah, it came gradually. So you'll have to lose that gradually. Okay, and you have to track your progress. Keep track of food, keep track of your activity, keep track of your weight, and stay motivated. Okay, another thing that you can do is manage stress level. So you can manage your stress level by doing yoga, meditation. Also there is something called mindfulness that also you can try. You can do another form of yoga that is called pranayama. So that is deep breathing exercises. Okay, and you have to stay socially connected. If you are isolated, if you stay alone, then there are chances that will be stress and you can never share your feelings with others. So this is also detrimental for diabetes management. Also, one important thing that few people speak about is the importance of sleep. अगर आप ठीक से सोओगे नहीं, if you don't have 7 to 8 hours of quality sleep to support your metabolism, then diabetes maintenance, diabetes management will be very tough. So sleep is a very important factor. Okay. So another thing is avoid smoking and limit alcohol. So smoking increases the risk of diabetes complications, especially when there is one type of non-communicable disease. Diabetes is a non-communicable disease. This means एक इंसान से another इंसान, if you touch or stay with that person, you are going to get diabetes. So if you have one non-communicable disease, then there is a chance of another non-communicable disease like you are suffering for you to suffer from another non-communicable disease, say hypertension. So if there is diabetes plus any other comorbidity like hypertension or hypothyroidism, yeah, and then again someone is smoking also, so their heart and kidney is at a high risk of getting bad. So quitting can be significant, and the quitting smoking can significantly improve overall health. Also, moderate alcohol intake. Alcohol, especially red wine, is sometimes said to be beneficial. But other than that, it's better that you have all other alcohol in very much moderation, and if possible, you have to leave that. Okay. Another thing, if someone is already a diabetic, then they have to monitor blood sugar level very regularly. Okay, and track blood pressure and cholesterol. And also schedule regular screenings for eye exams, foot exams, kidney function tests, like I already told you, and liver function test. So this helps to monitor the potential diabetes complications, because diabetes is never curable. Yeah, till now at least it's not curable. So what we can do is we can delay the complications. Complications ho hi nahi, yeah, delay ho jaye, hai na? So you have to regularly check eye, foot, kidney, and liver. So this is what we can do at our level. Okay, and our families can help. by reducing the total salt intake, by motivating us. Okay, so this is the way families can help, because families also keep in mind ki we already have one diabetic person in the family, and there is a high chance that everyone of us is at a very high risk of having diabetes. So maintaining a healthy lifestyle is profitable for everyone. ऐसा नहीं कि अरे this person is having so bland food, so he is not having sugary food, so we are suffering with him. So if that kind of mindset is not there, if it is like, okay, he is already having diabetes, and if we change our lifestyle, if we change our food style, food habits, then maybe we can we won't have diabetes ever. So if this kind of positive mindset is there in the family, then this also is a great motivator for the diabetic person. And now we have discussed about individual things, about the community, about the family. Now let us see what policymakers can do. They play a very crucial role in diabetes prevention and management, and they can promote healthy lifestyles. How? They can make policies that encourage physical activity, healthy eating, and education about wellness, and this can reduce the incidence of type 2 diabetes. Suppose they can introduce this one chapter on diabetes, promoting healthy lifestyle in school. This they can easily do, or they can introduce a wellness program in school or workplaces or public places. This can go a long way. Another thing that they can do is increase healthcare accessibility. Suppose there are community health centers, so this can be better equipped to diagnose, treat, and counsel people with diabetes, especially in remote and rural areas. Now what happens is, our doctors, I also work in a government hospital, so we are so overloaded with work, so many people come, okay, in tertiary care hospitals, that we don't get that much time, and it is always so full. The OPD is always so full, so we don't get much time to counsel and see actually ki, these people are following or not. So in my department, what we do is we go to the families, we adopt a whole area, and we go to the families to see ki un log ka lifestyle, what is their lifestyle, are they actually compliant on the medications, what is their salt intake, we calculate it, and what is the sugar intake, okay, and then we advise them accordingly. So this is the role of community medicine. And financial support for government also can give financial support for diabetic care. Right now, I think you all know that there is financial support for TB and all. Now, since diabetes is emerging so rapidly in India, I think there can be some financial support for diabetic care also. At least medicines should be given in subsidized rates. Insurance coverage also can be given to them, and there can be government programs to make diabetes management affordable to all. So with this, I'll just keep my speech short, because you have to listen. You already know a lot. You have already listened a lot. And if I jitna suna hai, if you practice that also, then it will be very beneficial for you. So today, I urge each one of you to take steps towards prevention, to encourage those at risk to get checked. So you go and tell them you have to get checked. Okay, if you think their family has a family history of diabetes, you tell them to get checked, especially if he or she is 30 already. And to support the initiatives that aim to make diabetes care accessible to all. Suppose you can also do small awareness campaigns, or you can make a poster, okay, to spread awareness. Because now you also know a lot, all the attendees. Let's commit to breaking the barriers. We have to break the barriers that hold us back and bridge the gaps that leave people behind. Okay, we have to take all the rural people with us. We have to take all the underprivileged people with us. We all have to take the vulnerable sections like drug addicts, the commercial sex workers, who are looking after them. We have to bridge these gaps. On this World Diabetes Day, let us remember that each one of us can make a difference. Okay, it's not because I'm a doctor, or someone is a public health worker, or someone is a very enthusiastic youth. Okay, only not them. Even each one of us can make a difference in diabetic care through personal choices, through supporting others, or advocating for policy change. You can do whatever you like. Koi bhi apna, you choose one thing that I'll do this through personal choices, I'll make the difference, or supporting others, I'll make the difference. Together we can work toward a future where diabetes is no longer a burden. Diabetes will always be there, but we want it to make no longer a burden, but a condition that can be effectively managed and prevented. So we want to make it effectively managed and prevented. So thank you everyone for joining us in this important cause. Together, let us break the barriers and bridge the gaps for a healthier future. Thank you.
Thank you, ma'am,
Thank you,
for your
ma'am.
such wiseful words. Now I would like to introduce our keynote speaker, Dr. Praveen Shankar. Dr. Praveen Shankar, MD, MRCP from UK, is a renowned consultant in diabetes and endocrinology who has been practicing in Ranchi, Jharkhand for the past 12 years. After completing his MBBS, Dr. Shankar pursued an MD in medicine and a diploma in child health at Darbhanga Medical College, Bihar. He furthered his medical qualifications in the UK, successfully completing the Royal College of Physicians Overseas Doctor Training Scheme. A significant part of his training involved 18 months in NSH hospitals specializing in diabetes and endocrinology, and he obtained his MRCP in 1999. Dr. Shankar has also held several prestigious international appointments. He served as an associate professor of medicine in Nepal and worked as a specialist registrar in diabetes and endocrinology in Singapore. Currently, he is a regional trainer in evidence-based diabetes management in Ranchi, certified by Dr. Mohan's Diabetes Education Academy and the Public Health Foundation of India. Since 2008, he has also been an ADA speaker in India, with over 15 publications in peer-reviewed journals. Dr. Shankar is an active member of several esteemed medical societies, including the Association of Physicians of India and the Endocrine Society USA. His dedication to promoting education and advancing patient care in diabetes and endocrinology is widely recognized. With this brief introduction, I am pleased to welcome Dr. Shankar to this podcast session. We are delighted to have you with us, sir. Thank you.
Thank you very much for this nice introduction.
A very good evening, sir. So I would like to request you to kindly turn the video on for our podcast session to begin.
Okay.
We're extremely delighted to have sir among us. And I guess this session that we're having today is a very general awareness about diabetes. And people from any stream, anybody who has questions about diabetes, general awareness questions about diabetes, should benefit from this session. So we're extremely grateful to have you today. I hope I'm audible, sir, to you.
Yes.
Yes, sir. Sir, I would like to start with the session with the very first question. That
Okay.
sir, India is known as the diabetes capital of the world. So, sir, why do you think that India is the leading country when it comes to diabetes?
Yeah, actually, if you had read the newspapers today, today a report has come from Lancet that India is actually the capital of diabetes in the world. And right now we have got 220 million people living with diabetes in our country. 220 million means more than 20 crore of people living with diabetes in our country. And this is far above the next figure, which is from China, which is 14.8 crore people. South Asians, we are South Asians, and South Asians are more prone to get diabetes. We get diabetes 2 to 3 decades earlier than the Caucasians, and we are 2 to 3 times more prone to get type 2 diabetes. And there are several reasons for that. The first is that we have got different kind of body composition. There is more fat in our body compared to the Caucasian people, and muscle mass is less. So we will see people who look, if you look at them, they don't look obese, or they don't look overweight, but then they have pot belly. The second thing is that we are genetically predisposed to get insulin resistance. And the third problem that we face is that our beta cell mass from birth, the beta cells are the cells which produce insulin. So our beta cell mass from birth is low compared to other ethnic groups. And now we are in a situation where we are progressing economically and we are getting rich. So we have got plenty of food to eat a lot of choices of food to eat. Our life has become sedentary. We are not doing much of physical activity. Many of us don't have good sleeping hours. Like we don't go for good night's sleep of at least 6 to 8 hours. A lot of us are in mental stress as well because of different regions, especially to build our career in a competitive world. So all these factors are predisposing us to get diabetes more compared to other ethnic groups.
Sure, sir. I guess this is some new information, at least for me. I guess this will actually benefit a lot. So the next question, as you just said, that sir, a lot of people think that diabetes is basically genetic. So, please let us know the difference between type 1 and type 2 diabetes.
Both the diabetes are polygenic in origin. It's not purely genetic, neither type 1 diabetes nor type 2 diabetes. In type 1 diabetes, you are genetically predisposed to get diabetes. There are certain HLA types which predispose you to get autoimmunity, and then you develop autoimmunity. Your beta cells start getting destroyed by your immune system. And then you get absolute deficiency of insulin and you get type 1 diabetes. So in type 1 diabetes, there is no insulin in your body at all. And you are dependent on insulin to stay alive and to control your blood sugar. In type 2 diabetes, again, we are genetically predisposed to get this condition. Plus, we have got environmental factors coming into play as well. And both of them lead to the genesis of type 2 diabetes. So they are not purely genetic diseases. They are polygenic disease. Other diseases like hypertension, coronary artery disease, they are all polygenic diseases.
Sure, sir. So what are the basic symptoms when somebody has got diabetes, and like what should be his immediate action? Like getting a blood test, or what should be his immediate action when somebody has got diabetes?
The problem with like in type 1 diabetes, you present with classical symptoms of excessive thirst, excess weight loss, excessive appetite, all these things. But in type 2 diabetes, most of the patients, they don't get any symptoms. 60% of the patients, they do not get any symptoms of high blood sugar, and they get diagnosed with diabetes when they have their blood sugar tested for some other region. The classical symptoms are excessive thirst, excessive desire for food, loss of body weight, all these things, tiredness, etc. So if you get all of this, you should go to see a doctor. You can go and see your family doctor, and depending on your symptoms and the assessment that he does, he will order some blood test, especially blood sugar test, and based on the result of that, he will establish the diagnosis of diabetes.
Sure.
No, I'll just interrupt. And can I add a few more symptoms because people will be listening?
Yeah, please. Go ahead.
Yeah. So the patient also might be having polyuria, that is frequent urination. So this is one of the very important symptoms. And also if he or she notices that there is a wound that used to heal, very quickly otherwise, but now it is delayed healing. So this is also a very important sign. Otherwise, there can be very non-specific signs like, tiredness and malaise, that he or she used to be very energetic earlier, but now there is significant tired and malaise. So this otherwise can be very blatantly neglected by people. But if he or she has a family history, he should immediately go and get his blood tested. And also, I would like to say, even without family history nowadays, as soon as a person is 30, he should get his blood sugar tested, because in India right now, we are having a great emergence of diabetes. Okay, and this is multifactorial. I won't go into the factors, but right now everyone should be very aware.
Sure, ma'am. Thanks for this information, ma'am. So, sir, as I proceed, the next question I would like to ask is that people often have this conception that even if a person who is absolutely healthy has too much of
Hmm.
sugar, then he would get diabetes. So, sir, can you please elaborate on this?
Yeah, that is true. If your sugar is your enemy number one, so if you're taking excess of simple carbohydrate like sugar, jaggery, or honey, then you are making yourself prone to get diabetes. Because as I said earlier, being South Asians, we are more prone to get diabetes. And on top of that, if our food quality is not good, then the risk of getting diabetes multiplies several folds.
Sure, sir. So, with this, the next question follows that diabetic patients often have this misconception that if they just stay away from sweets in particular, that is the only way they can control diabetes. They tend to overlook the total carbohydrate intake. And so, what should be their approach when it, comes to the sugar intake?
Sugar, like simple carbohydrate, you should not be taking at all. For complex carbohydrate as well, the amount of complex carbohydrate should be limited. And the problem with Indian diet is that we in our diet there is too much of carbohydrate. In our diet, there is 65 to 70% carbohydrate content. If you calculate the total diet in terms of kilocalories, 65 to 70% of kilocalories is made up of carbohydrate, and less of fat, and even less of protein. So our aim should be to cut down on the complex carbohydrate as well, not only simple carbohydrate, and bring it down by at least 10%. So the carbohydrate content in our diet should be 50 to 55%, and at the same time we should increase the amount of protein or the percentage of protein in our diet. So if we change the composition of diet, that will help immensely to control our blood sugar smoothly, and in that way we will require less of anti-diabetic agents to control our blood sugar. So that is
Sure,
very
sir.
important.
This is really important for us. I guess diabetes is a problem of every family almost. And so these
Yeah.
information is something which we do not tend to get from Google or whatever stuff ma'am was also
Yes.
mentioning. So for this, we need you people, sir, to get these informations. And I would proceed to the next question. So these days we see lots of advertisements about, sugar-free sweets and biscuits. So do you think this is actually beneficial for the diabetic patients, or this is just a typical marketing strategy?
I think it's more of marketing strategy. It's not a healthy food. Nowadays, we are getting evidence that even artificial sweeteners are not good for your health.
Yes.
Now, the research is telling us that the bacteria in our large intestine, they play a very big role in our health, especially in our metabolic health. And there is evidence coming up that these artificial sweeteners, they disturb the composition of bacteria in our large intestine. So in long run, they are also not healthy for our health. And all these sugar-free food, they may be free of sugar, they may be containing artificial sweeteners, but at the same time, the fat content of these food will be high as well. So that makes these kind of food not healthy. So you should not be attracted to them.
Sure, sir. This is really important. Sir, the diabetic patients, especially in India, they do not often realize the importance of regular blood testing. So, like, how frequent should a person suffering from diabetes get tested? And also, sir, people are often attracted towards the, not conventional, but the chip test method, which are like at home they can, prick the fingers and do that. So, what should be their method of checking their blood sugar level, and in what intervals?
How often you should be getting your blood test done, that will be decided by your treating doctor. If you want to test your blood sugar at home, you should be using glucometer to test your blood sugar. Nowadays, now we have got continuous glucose monitoring systems as well. That what you do is you have to you stick a small device in the deltoid region of your hand, and that will continuously measure your blood sugar. That will measure your blood sugar every 5 minutes and give you an average of 2 weeks. And then you have to change the device, and then again you can measure. So you can go for continuous blood sugar measurement, or you can use a glucometer and do frequent blood sugar measurement. The thing is that nowadays, there are two purposes of doing blood sugar at home. One is to avoid low blood sugar, that is hypoglycemia. Second is to know how the sugar control is. Nowadays, we have got very good medicines which do not pose a risk of low blood sugar. So if you are on those medicines and you ask your doctor, and if your doctor says that it's not mandatory for you to do blood sugar at home, you may skip that. But there are certain medicines, if you are on these medicines like sulfonylureas, like glimepiride or gliclazide or insulin injection, these medicines can put you at risk of getting sudden low blood sugar. So in that situation, you have to monitor your blood sugar at home. So your doctor is the best guy to tell you whether you need to measure blood sugar at home or not. If you are talking for doing glucose measurement in your urine, so that is obsolete now. No doctor will recommend you to do that, and that is not the scientific measure to monitor your blood sugar at home. So it should not be done. Urine glucose should not be done.
Sure. So this was a really important information. Sir, can you please let us know if any diet or any lifestyle method which a diabetic patient should strictly avoid, like an absolute no for diabetes patients?
As Dr. Sarkar was also telling us, she beautifully presented what diet we should be taking. So what I will just add that we should, as I said in my earlier answer to your question, that we should not be eating any simple carbohydrate. We should restrict the amount of complex carbohydrate, and we should increase the amount of protein that we are taking. And if you are taking fat, we should avoid saturated fat. Saturated fat is mainly of animal origin. So if you are taking an animal food, you should be going for lean meat. And if you're taking fat, then you should go for healthy fat like polyunsaturated or unsaturated fat, which will contain omega-3 and right composition of omega-3 and omega-6 fatty acid. So these are things that you should be doing.
Sure, sir. And as Amrita ma'am also said, these are actually important for us.
Sir, we elaborated nicely.
Absolutely. Thanks to ma'am also. Sir, can you please let us know about the health risks of diabetes? Like if it is left untreated, then what are the complications that can arise?
The problem is with diabetes is that it affects your blood vessels. So it affects both your large and small blood vessels. And you know that blood vessels are in each and every part of your body. So diabetes can affect right from your brain to the toes of your feet. So the main complications of diabetes are divided into two parts. One is microvascular complication, where the small blood vessels are involved, and that leads to diabetic eye disease, where which is known as diabetic retinopathy, where you run the risk of getting visual loss. Then you can get kidney affected, so diabetic kidney disease, and you can go into kidney failure, and then you have to go for dialysis or kidney transplant, etc. Then diabetes can affect the nerves of your body. So the nerves die down, so your part of the body where the nerves have died down becomes numb. The sensation there is lost. So mainly it affects your feet. So the sensation of your toes and your sole is lost. So if you get any injury, if you get any cut or any other injury, you will not be able to detect that because it is numb. and then it will get infected, and then you can develop diabetic foot. So these are the main microvascular complications. Macrovascular complications are where you get involvement of the large blood vessels of your body. So you get a heart disease, coronary artery disease, you get stroke, where you get paralysis of some part of your body. So these are the main macrovascular diseases, which is also called cardiovascular disease.
I guess
So these are the main.
yes.
Yeah.
These are what-
Nowadays, the research is telling us that diabetes can also cause dementia. So you can get dementia also because of diabetes. So in nutshell, diabetes can affect any part of your body.
So these complications people should be aware of. At least then they would start taking this seriously in the earlier stages, which they fail to most.
Yeah. As Dr. Sarkar was telling us, there is huge lack of awareness in our population, and it's very important that we make our population aware so that we can fight this epidemic that is right now affecting our population, especially the working population. And it has got enormous impact on the GDP and economy of our country, because in our country, people in their 20s, 30s, 40s, they are getting affected with diabetes, and that is the period where you work the most and you build your career. So each individual building career, the career of the economy of the country is built up. So it's a big problem for us, and I think all of us should realize that and work towards awakening and making aware our people so that we can manage this epidemic in a better way.
Sure, sir. So Amrita ma'am also mentioned some ways, which diabetes patients should follow for a better lifestyle. But if you want to add something to that.
Yeah, I think she emphasized on three things. The most important thing is diet. So you should control your diet first. After that, you should do exercise. Exercise are of two types, aerobic exercises and resistance exercises. Aerobic exercises are like swimming, walking, running, playing racket games. So these are aerobic exercises. So that only is not very helpful in controlling your blood sugar and keeping your body weight in control. You should do resistance training as well, like lifting body weight, etc. And the third thing is good sleep. So you should have at least 6 to 8 hours of good night's sleep. Especially what I see in our younger generation, they are not following the nature's law. Everybody is going to sleep at 2 o'clock, 3 o'clock in the morning and sleeping till 10, 11, 12 o'clock in the morning. So that is not good. In our body, we have got a gland called pineal gland, which is the timekeeper of our body. And that gland runs on the sun rays. So with sunrise, this gland gets activated. And that gland controls the secretion of different hormones from our body. So our hormones are not secreted in a regular fashion. There are times where the secretion of hormones will be high. There are times where the secretion of the hormones will be low or less, and that is all guided by the pineal gland. So if we are not staying according to the nature's call, not going to sleep early in the night and waking up early in the morning, then we are not following our body's command, and that will result in diseases like diabetes, heart disease, hypertension, all these things. So good night's sleep is very important.
Sure, sir. We all need to look at this. So the next question is, sir, is there anything a healthy person can do to prevent diabetes?
Yeah, healthy lifestyle is very important. Again, diet, exercise, and good sleep. Avoiding mental stress. If you are in a stress situation, you should do something to calm down your body. So yoga is very good exercise for calming down your body. And doing things like, you should not always be working. You should develop some hobby and you should spend some time in following your hobby as well, so that brings down your mental stress and keeps you calm. So these are very important.
Sure, sir. So the last question is, being a diabetes specialist over the years, what has been your overall experience dealing with diabetes patients, especially in India?
Yeah, I think there is lack of awareness in people with diabetes and in their family members about how to live their life. So it's very important that we spread awareness. The second thing is that what we are talking about today is mainly type 2 diabetes. So what I want to tell all of you is that type 2 diabetes is not a single disease. It's a 3-in-1 disease. You get diabetes, you get high blood pressure, and you get cholesterol problem. More than 80% of people who have got diabetes have got all these 3 problems together. So if your doctor or you think that if you control your blood sugar only, you will be staying healthy, that is not correct. You should be controlling not your blood sugar, you should be controlling your blood pressure and your cholesterol level as well. Because if you do that, you can avoid long-term complications of diabetes. What happens that in diabetes, 2/3 of people, they die of heart attack. So the impact of heart attack is so much in people with type 2 diabetes. So if you control all these 3 factors together, then you will be living a disease-free life. What I tell my people is that diabetes is like wearing a spec. Like if I'm wearing my spec, I'm all right. My vision is normal and I can do all my normal activities. So similarly, if you've got diabetes, you should not worry about that. You should control your blood sugar, stay healthy, and you will not get any problem. You will meet people who have got diabetes for 50 years, 60 years, and they don't have any complication at all. So controlling your sugars is very important.
Thank you so much, sir. We are really grateful for all these insights that you did give. So with this, we come to the end of the podcast session with sir. And I would like to ask the audience if you have any questions to ask sir.
To interrupt you,
Yes.
Ajay sir is there. Kunchala will be introducing Ajay sir. Kunchala, can you proceed?
Yes, surely. A very good evening to everyone. Present here, I, Pranavi, serve as organizing committee under GFSRD. Now, I would like to take up the honor to invite and welcome our deputy patron, Autonomous Ranchi, Jharkhand. He has served as the coordinator in charge of the Internal Quality Assurance Cell of St. Xavier's College, Autonomous Ranchi, Jharkhand. He has been the state president of Microbiologist Society India. Sir has been awarded with many national and international awards and also the Best Citizen of India awardee. Sir is a recipient of one of the Best Environmental Scientist of India award. Dr. Ajay Kumar Srivastava sir is currently serving as the All India Executive Convener of Microbiologist Society India and also the chairman of Global Forum for Sustainable Rural Development Jharkhand chapter. With such a profound experience, we are highly delighted to welcome Dr. Srivastava sir, an eminent personality for today's event. Over to you, sir.
Is Ajay
Sir
sir
has
there in
got
this meeting?
disconnected, I guess. So I would now like to welcome the chief patron of the event, and I would like to introduce Dr. Jayanta sir. Dr. Jayanta Chaudhary sir is basically the founder and the secretary general of GFSRD. He is presently working as faculty Department of Rural Management and Development, Tripura University. He's also he has done his PhD and masters in rural
Oh,
development.
can
Yes,
we, please. No need
okay,
of this because today our chief guest, he's most important.
okay, sir.
Let me chip in there. Uh, on behalf of GFSRD and on behalf of entire organizing team, sir, we are delighted to listen from you and so many issues, and it is important. And nowadays, diabetic as a uh, not as a disease, it is like each and every family is suffering, even including me. So, and that's why today's program is so much important, and we have learned a lot, uh, particularly the lifestyle and other things, how we can manage. And obviously, for my personal thing, I'll consult with you. But overall, it is a very good session inside, and we learn a lot from this. And I am thankful to that organizing committee who have arranged and who invited that took everything. Today is a special day in that sense. Both is not only the diabetic day but also as a National Children Day. And diabetic, the children are also nowadays suffering from that. So all the way, it is a very important issue, and we are happy to get you. And again, on behalf of Global Forum for Sustainable Rural Development and this Global Center for Youth Development and Global Center for Public Health Care and Management, who are organizing this today's event. And it's a very nice, and I am thankful to the organizer, particularly all my young team. They have done this and they have taken this very seriously. And this is very serious issue. Indeed. It's called silent killer. And when we are habituated to so much, even in my family, uh, I'm not getting proper time to for exercise or these. This is, I mean, slowly I'm in the trap of maybe this thing. So, and this is not the case for me, maybe for others also, they are suffering. And slowly these diseases, uh, like a it's called like a endemic situation is going on. So, thanks to sir for joining us and spare his time with us. Lot of insight regarding diabetic, all sorts of, and obviously thank to Professor Ajay Srivastav ji, our Chhattisgarh Jharkhand head, and also thanks to the all the team members who have done this program very nicely. And once again, I welcome on behalf of GFSRD. Uh, Stay with us. There are many more programs are being organized by our team, and we'll be very happy if you have any suggestion, if you have any kinds of idea, please share with us. As you are well aware that Global Forum for Sustainable Rural Development, the journey we started, and now it has reached to many more countries. Lot of country directors they have joined, and every day we are trying to add some value addition to this forum, and we will be happy to get your support and your expertise, your network, and your knowledge together. And last but not the least, once again, we are thankful, sir, for your valuable speech and spending time with us. Thank you very much. Thank you, team. Thank.
Thank you so much, sir, for joining in and sharing your words. Now, I would like to ask the audience if you have any questions to ask, please, please write your questions in the chat box. Meanwhile, Sir Praveen, sir, I would like to request you to kindly answer to a couple of questions that have come up. Khushi
Okay.
Singh, yes, sir. Khushi Singh has a question. is homeopathic medicine helpful for curing diabetes?
I don't think so. The thing is that the modern medicine, they have been tested. What is being done is that we do trials on patients, and based on the trial, we decide whether the medicine is effective in a particular disease or not, whether the medicine is well tolerated in patients who are taking these medicine or not, and then only the approval is given for the medicines to be marketed. I don't think any such system exists for homeopathic medicines. So I don't think I would advise you to go for homeopathic medicine if you want to treat your diabetes or if you want to prevent diabetes.
Sure, sir. Another question from Shakila Madhu is, he's asking about gene therapy in diabetes.
Gene therapy is mainly for diseases which are monogenic diseases, which occur because of the defect in one gene. Diabetes is a polygenic disease. There are defects in several genes, and these directly do not produce disease. Like in monogenic diseases, you have got defect in a gene, and that will result in a disease. In polygenic disease, you have got defects in many genes, but that will not directly cause the disease. There is interaction between your genes and the environment, and then the disease will be produced. So the gene therapy is not going to be effective alone in diabetes.
All right, sir. So the next question.
Nitika, I would
Yes.
like to interrupt.
Yes.
Ajay sir is there. Like, we would request Ajay sir to say a few words on this occasion. Ajay sir, please, can you do the honors?
All right. We'll move on to questions later. So, Ajay, sir, please.
No, Ajay sir means me.
Yes, sir.
Okay.
Yes,
Thanks. Thank you. Well, it's a great honor to be with you people, the young people, and the evergreen, our Dr. Praveen Shankar sir. My personal experience with him has been tremendous, and he has handled many difficult, very seemingly impossible cases with such an elan that it surprised me and the people around me. How can a person, a medical professional, handle such complicated, difficult case in a jiffy like this? So, well, we need to be very careful about this. As I mentioned it in the message box, that previously what we used to have means, 200 years ago, we were not used to having sweets like this, the concentrated sugar sweets. Today we have dessert, and and we just play trant with that. We eat sweets, gulab jamun, then jalebi, then chena, then this, and then and ending up with ice cream. So we are playing with ourselves. We are playing with our system. Earlier, a little bit of gur was okay. When somebody was very tired and coming from the sun, and obviously the sugar level must have been down like anything, we used to have a little bit of batasha and water. That was enough. But the thing has changed. We used to do hard work, but now machine and things have made it very easy. But yes, I do not blame the modern amenities, and the life expectancy has increased. Previously, expectancy was very low, 46 or less than 50. So many people were dying undiagnosed. Maybe they used to die early from diabetes, and we did not know about that. So that might have been, but yes, the medical profession today has done a great thing, and we need all the different branches of medical science to amalgamate, to understand the value of one another, and maybe one becomes the helping hand for another branch of science for the treatment of diabetes. Yes, diabetes is a very complicated thing, and I used to think that it is an impossible thing to treat. But with people like Dr. Praveen Shankar, he's just a ray of hope for the people who have diabetes. Okay, thank you very much for inviting me. Thank you.
Thank you, Nikita. You can on your audio.
Oops, I'm so sorry. So yeah, as Sir just said, so we, our entire GCFRD team, we are like really grateful to have such an eminent personality like Praveen Sir with us today, and to have shared so much of his views on general awareness of diabetes. And I guess our entire audience has really, like got help from this session. I myself, has this thing benefited from it. I can say that, and I can say this for everybody in general. Sir, I would like to ask you one more question that we have in the chat box.
Yeah.
That is from Shilajit Mujumdar. So, what are the things a person on pre-diabetic conditions should be aware about?
The first thing is that you should control your diet, as I mentioned earlier. Do regular exercise, have a good night's sleep, and keep an eye on your body weight. Because for Caucasians or for other parts of the world, the parameters are different from us. You are aware of BMI, body mass index.
Yes,
So
sir.
you calculate body mass index with the help of your weight and height. So our body mass index should not be more than 23. So that is one thing. The second thing is that BMI of less than 23 is not the only thing that you have to keep an eye on. Your waist circumference should also be in the right direction. So if you are a male, your waist circumference should not be more than 90 centimeters. If you are a female, it should not be more than 80 centimeters. I think for us South Asians, waist circumference is more important than body mass index. So you keep an eye on your diet, go for healthy diet, do regular exercise, avoid mental stress, have a good night's sleep, and keep an eye on your BMI and waist circumference. And then you can avoid developing your pre-diabetes to diabetes, and many a times you can bring your pre-diabetes back to normal sugar as well.
Thank you so much, sir. This was really helpful. And we have one last question from Khushi Singh. Are pregnant women more prone to diabetes?
Yeah, nowadays, sorry, what are pregnant women more prone to
Prone to
diabetes? Yeah,
diabetes. Yes.
the thing is that diabetes is affecting the whole society. So if it is affecting the whole society, it's affecting children, it's affecting adults, it's affecting childbearing age women as well. So nowadays I see a lot of women who are getting pregnant and then they are developing diabetes, which is known as gestational diabetes. I'm also seeing women who have got diabetes and then now they want to become pregnant. So yes, as the general incidence of type 2 diabetes is increasing in society, the incidence of type 2 diabetes and gestational diabetes is also increasing among women of childbearing age. So that is a big problem as well.
Thank you so much, sir, from the entire audience, from the entire GSFRD team. I would like to thank you very much for this inspiring and knowledgeable session. And with this, we come to the end of such a podcast session. And I would like to request Ruchika to kindly, give your vote of thanks. Thank you, sir. Thank you, everyone.
Distinguished guests, esteemed speakers, colleagues, and participants from around the world, it is my great honor and privilege to deliver the vote of thanks for this year's podcast session on the occasion of the World Diabetes Day. As we come to the close of an enlightening and thought provoking gathering, I want to express our deep gratitude to everyone who has made this international podcast session a remarkable success. First and foremost, I extend our heartfelt thanks to our keynote speakers, panelists, and presenters. Your expertise, perspectives, and groundbreaking research have enriched our sessions and sparked important conversations that will continue beyond this session. Thank you for sharing your knowledge and insights with us. To our international delegates and participants who joined us from various parts of the world, thank you for your engagement, questions, and contributions. Your presence and active participation have been integral to the success of this event, fostering an exchange of ideas and embodies the spirit of global collaboration. A special thanks to the organizing committee and all our dedicated volunteers for their incredible hard work and meticulous planning. Your attention to detail and commitment to excellence have ensured the smooth running of this event, both in person and online. Our gratitude also goes to our partners for their generous support. Your belief in the importance of this event has provided us with the means to bring together experts and participants from across the globe, and for that, we are truly grateful. Finally, a big thank to you to the technical team who made it possible to connect and communicate seamlessly across borders and time zones. Your efforts allowed us to engage with one another, share knowledge, and strengthen connections worldwide. Thank you all once again for making this podcast session such a successful and memorable event. We look forward to the new collaborations, innovations, and insights that will merge from our discussions here. Safe travels to everyone, and we hope to see you at the next year's event.
Thank
Now,
you.
this meeting is officially ended. Thank you all for joining.
Thank you everyone for joining in. The participants will be given the certificates within 7 working days, and we will be proceeding for the same after seeing your eligibility. Thank you everyone for joining, and see you in the upcoming events of our organization. Thank you everyone for your contribution. Now you may leave the meeting. Thank you.